Welcome back to Ozarks Tonight. Colorectal cancers are among the most treatable forms of cancer if detected early. In Missouri last year, more than 3,100 people were diagnosed with colorectal cancer. Here to tell us more about the importance of getting your screenings even during a pandemic are Dr. MAGDY GIURGIUS from Ozarks Medical Center in West Plains and Tim Freeman from the American Cancer Society Cancer Action Network. Thank you both for being here.
Thanks for having us.
Thank you for having us.
Now, Dr. GIURGIUS, are you noticing fewer people getting screened since COVID started?
I think when initially the wave started, we've been seeing a lot of patients very cautious and worried about getting any kind of hospitalization or going as an outpatient procedure. So the answer is yes. But afterwards, when we started to have things more stabilized at the Ozarks Healthcare, we started to have more steady flow of patients coming for screening. We've been taking all appropriate measures to protect our patients.
And describe the value of getting colorectal screenings. How does it save lives?
Well, we have to understand that colorectal cancer is the second leading cause of cancer death in the United States among men and women combined. And we are estimated to have about 148,000 adults expected to be diagnosed with colorectal cancer in 2020. So it is pretty important to have screening, and it's one of the few cancers that we are able to screen for. We all have other cancers that we are not able to screen for yet.
At what age should these screenings start?
So it used notoriously to be the age of 50, but currently the guidelines have changed, and we started screening men and women at average risk at age of 45.
And if a polyp is discovered during a screening, that entire polyp is removed, correct?
That's correct, for the most part, unless the polyp is so large that may require different sessions, and sometimes surgical intervention is warranted.
And that's where it can cost people in the financial aspect as well. The ACS CAN advocates for patients, and Tim, the organization was urging Congress to support the Removing Barriers to Colorectal Screening Act. It recently unanimously passed the House. So give us some background on that.
Yeah, it's a bill we've been working on for several years. I'm proud to say it's really a victory for our advocates, our volunteer advocates. Every member of the Missouri delegation, all of our 8 House members, including Congressman Long, signed on as co-sponsors, as did both Senator Blunt and Senator Hawley here in Missouri. So we are extremely excited to have that support from our entire delegation. Again, that's credit to our volunteers. They reached out to those members of Congress. They educated them, they educated their staff, and brought this to their attention to let them know. But basically what happens is in Medicare, some folks get the screening, and when they get the screening, it changes. If a polyp is found and removed, it's changed from a screening to a procedural diagnosis, and so it changes how it is billed. And so people wake up after what they thought was just going to be a screening, and if a polyp was removed, all of a sudden they have a bill that they have to pay. So it's a twofold problem. Number one is the surprise billing that people get, and number two is now that people have been hearing about these surprise bills that other folks are getting, people are deciding that if they can't afford that surprise bill, that they're not going in and getting their screenings. And so this is a piece of legislation that's very important so that we can stop this surprise billing for folks that go in and get these tests, and we can make sure that people aren't not getting the test because of the surprise billing.
And are there studies or anything that have found cost sharing actually deters people from getting that preventative screening? What are the numbers looking like with that?
I don't know if we've seen specific numbers, but we do know that less people are going because of the cost sharing. We've talked to volunteers across the country who have heard stories from folks who are finding out about this, and that is deterring people to go in. And, you know, early detection is so important. We don't want there to be any barriers out there for folks to go in and get these screenings.
So what do you believe would be the outcome if people don't have to worry about costs at all?
Well, hopefully, if people don't have to worry about it, they're going to know that they can go in, get these tests, and early detection is the key, especially for colorectal cancer. If you get screened early and they catch it in an early stage, it's much more treatable, and people survive much longer after being diagnosed early. So our hope is that people will realize that, you know, it's important to get the early screenings, and it's safe for them to go back now, even during this pandemic.
And I read on ACSCAN's website more than half of all colorectal cancer patients in the U.S. have Medicare. Dr. GIURGIUS, what advice do you have for people who maybe due to get that screening but are a little bit nervous to go to the hospital because of the pandemic?
Well, I will tell a quick message to the public that, first of all, there are several ways of screening colorectal cancer, including the testing in stool, the fecal immunochemical testing, the high sensitivity guaiac fecal occult blood test, and there are stool DNAs, but the gold standard is the colonoscopy. I will tell to the public at Ozarks Healthcare, we have applied every safe measures to secure patient safety. We test patients for COVID-19 using a PCR testing with a 7 days frame per CDC guidelines prior to an elective procedure, which is the case with colonoscopy. We get folks accommodated. We see them in the office and we have them screened safely, and we have fantastic accommodation for them. And I would encourage every person who meet the criteria for colorectal screening to go and check with the primary care providers, the surgical specialists. I do perform weight loss surgeries as well, and I offer screening colonoscopies for my bariatric surgery patients before surgeries to make sure that they are updated. So we do have a very safe environment, and I would encourage people to go ahead and schedule their colonoscopies.
And Tim, what's the best way for people to learn more about ACSCAN's involvement in all of this?
Sure. They can follow us on Facebook or Twitter, or they can always go to our website, fightcancer.org. A lot of information there, not only on this bill, but all the things that we work on. And there are places they can click so that they can get in touch with us so that they can become more involved. And like I said, this Removing Barriers to Colorectal Cancer bill is a perfect example of our volunteer advocates being involved, educating their lawmakers, and seeing something accomplished like this that will hopefully help save lives.
All right. Thank you both so much for being here. We appreciate it.
Thanks, Heather.
We will be right back with more Ozarks Tonight. Keep it here.